If you're over 60, this message could save your life. Stroke rarely gives a warning. One moment you feel fine, and the next, your speech slips, your arm won't lift, or your balance disappears. As a neurologist, I've seen far too many older adults suffer brain damage not because of accidents or bad habits, but because of something they thought was helping them: vitamins. Every day, millions of seniors take supplements to protect their heart, boost energy, or improve memory. But here's what no one tells you. Certain common vitamins, especially when taken in high doses or at the wrong time, can quietly raise your stroke risk overnight. You might think you're doing something healthy, but your brain may be paying the price in silence. In this discussion, I'll reveal 5 specific vitamins that could increase your risk of brain bleeds, blood clots, or sudden spikes in blood pressure, especially in the early morning hours when your brain is most vulnerable. You'll hear real stories from my patients, backed by science, and learn what to take instead to truly protect your brain. Stay with me, because the vitamins in your cabinet may be doing more harm than good. Vitamin D, the sunshine pill that could turn deadly overnight. You've probably been told that vitamin D is good for your bones, good for your mood, and essential as you age. That's true, but only part of the story. What many seniors don't realize is that too much vitamin D, or taking it at the wrong time, can quietly lead your brain into dangerous territory, even causing a stroke in your sleep. I remember a patient of mine, Mr. Thomas, 74 years old, a retired Navy veteran. He was active, alert, and took pride in managing his health. Every morning, he took his vitamins with military discipline, including a high-dose vitamin D supplement he bought over-the-counter 10,000 IU daily. The stronger the better, he said with a smile. He believed it was protecting his bones. What he didn't know was that he was slowly setting himself up for disaster. One morning, his wife found him confused, unable to speak clearly, and with weakness in his right arm. He had suffered a silent overnight stroke. When we ran his labs, his calcium levels were dangerously high. His arteries were stiff, his blood pressure was erratic, and his blood vessels, especially in the brain, were under enormous pressure. The culprit? Vitamin D toxicity. You see, when seniors take high doses of vitamin D without medical guidance, especially before bed, it causes calcium to build up in the bloodstream. Your body doesn't know what to do with all that extra calcium, so it deposits it into your blood vessels, making them stiff, narrow, and prone to clotting. And guess where that clot can go? Straight to your brain. As we age, our arteries are already less flexible. Add in dehydration, poor sleep, and a spike in calcium overnight, and you create a perfect storm for stroke. What makes it so terrifying is that there are no warnings. You go to bed feeling fine, and the next morning your speech is slurred, your arm won't move, or your memory is gone. Just like that. And let's be honest, most over-the-counter vitamin D supplements sold in the US come in doses far higher than seniors actually need. Many people take 5,000 to 10,000 IU every single day, thinking more is better. But research shows that for older adults, even 2,000 IU daily can be too much if you're not deficient. The cost of that mistake? Your independence, your speech, your ability to hold your grandchildren, maybe even your life. If you're taking vitamin D, especially if you're also on calcium or heart medications, it's critical to have your blood levels checked regularly and to take it in the morning, not at night. Never self-prescribe high doses, and never assume a vitamin can't be dangerous, because sometimes what looks like a harmless habit is the very thing putting your brain at risk while you sleep. Vitamin E, the heart-healthy supplement that can trigger a brain hemorrhage. Most seniors take vitamin E thinking it's good for their heart, their skin, their immune system. And yes, in the right dose, it can help. But what many people don't know, especially those over 65, is that vitamin E can quietly become one of the most dangerous supplements in your medicine cabinet, especially if you're on blood thinners or have high blood pressure. I remember one patient vividly. Mrs. Eleanor James, 81 years old, a retired librarian from Ohio, sharp as a tack, always reading, always aware. She had been taking warfarin for a heart valve issue, and everything was under control. But without telling her doctor, she added, in a natural vitamin E capsule she saw in a health magazine, 800 IU daily. I just wanted to help my memory and circulation, she told me. 3 weeks later, she was rushed into the ER with sudden confusion, headache, and vomiting. A brain scan showed a hemorrhagic stroke, a bleed inside her brain. The cause wasn't trauma or even uncontrolled blood pressure. It was the combination of warfarin and high-dose vitamin E, both thinning her blood to the point where even a small vessel in the brain burst. You see, vitamin E acts like a natural anticoagulant. When taken alone, it may not cause an issue. But when combined with medications like aspirin, Plavix, or blood thinners like Eliquis or warfarin, it can push your blood's clotting ability over the edge. And with age, your blood vessels become more fragile. One tiny rupture, and your life can change forever. Brain bleeds don't just affect your memory. They can rob you of your ability to speak, to walk, to live independently. And often, they happen with no warning at all. You go to sleep fine, and wake up in an ambulance if you're lucky. What's even more concerning is that many vitamin supplements sold in the US contain far more vitamin E than seniors need. The recommended daily intake for older adults is only 15 milligrams, about 22 IU. But most supplements come with 200, 400, even 1000 IU, and people take them daily without a second thought. You might think it's harmless, but if you're over 65 and on blood thinners, you're gambling with your brain every time you take that pill. Mrs. James survived, but she now uses a walker and struggles with short-term memory. She told me later, through tears, I just wanted to help myself. I didn't know I was doing harm. Let me be clear, not every vitamin is safe just because it's over the counter. If you're on medication, especially anything that affects your heart or blood, you must talk to your doctor before adding supplements. Vitamin B6, the nerve helper that can slowly rob you of balance and brain control. If you're over 60, chances are you've been told that vitamin B6 helps with energy, nerve health, or even memory. You may have read about it online or seen it in a senior brain support bottle at the pharmacy. But what no one warned you about, and what I've seen firsthand in my own practice, is that too much vitamin B6 can cause irreversible nerve damage, especially in older adults. Let me tell you about Mr. Harold Carter, age 76, a retired truck driver from Kansas. He came into my office complaining of numbness in his feet, trouble keeping his balance, and a strange sensation in his hands like pins and needles that never went away. At first, he thought it was just part of aging. Then he started falling. First once, then again in the bathroom. It wasn't until the third fall that he hit his head and ended up in the ER with a mild concussion. When I reviewed his medications, something stood out. He had been taking a high-dose nerve support vitamin daily for over a year. The label said it supported circulation and brain function, but it contained 100 milligrams of vitamin B6 per tablet. That's over 6 times the recommended daily allowance. And worse, he'd been taking 2 tablets per day, thinking it was helping him. What was really happening was chronic B6 toxicity. Unlike other vitamins that simply flush out in urine, vitamin B6 can accumulate in the nervous system over time, damaging the protective sheath around your nerves like stripping insulation from a wire. The result? Numbness, muscle weakness, tremors, loss of coordination, and even memory issues. And the scariest part is, the nerve damage can become permanent. Many seniors confuse these symptoms with aging, arthritis, or even early dementia. But in reality, they may be walking around with a silent, preventable neurotoxic condition caused by a pill they thought was helping them. Mr. Carter was lucky. We caught it early enough to stop the damage from progressing, but his balance never fully recovered. He now uses a cane and limits his driving. I thought I was protecting my brain, he told me. I didn't realize I was poisoning it. Here's the truth. Older adults should never take high doses of B6 without medical supervision. The safe daily limit for seniors is around 2 to 10 milligrams, and even that depends on diet, kidney function, and other medications. No one tells you that brain vitamins sold in stores, especially those targeted at seniors, often contain megadoses far beyond what the body needs. And the long-term cost isn't just numb fingers, it's falls, broken bones, traumatic brain injuries, or worse, losing your independence altogether. Vitamin A, the vision booster, that can secretly build pressure inside your brain. Vitamin A is one of those supplements that sounds innocent, even essential. We hear it's good for eyesight, immune health, and skin. But what's rarely discussed, especially with older adults, is how too much vitamin A can quietly build up in your body, increasing the pressure inside your skull and, in some cases, leading to a brain emergency that feels like a stroke. I'll never forget Miss Lillian Moore, age 79, a retired piano teacher from Oregon. She came to see me after weeks of worsening headaches, blurred vision, and dizziness. At first, her family thought it might be the onset of dementia. But when she started slurring her words and struggling to find her balance, they feared something worse, a stroke. The MRI didn't show a clot or a bleed, but it did show elevated intracranial pressure. Her spinal fluid was backed up, and the tiny veins in her brain were under extreme stress. It wasn't caused by trauma or a tumor. It was her daily vitamin A supplement, a skin and eye health formula she'd been faithfully taking for years. The problem is this. Vitamin A is fat, soluble, which means it doesn't leave your body like vitamin C or B vitamins. It accumulates in your liver, your tissues, and over time, in your brain. Seniors are especially vulnerable because liver function naturally slows with age, and many don't realize their multivitamin already includes a full day's dose before they add more on top. Excess vitamin A, particularly the retinol form found in many supplements, can lead to a condition called pseudotumor cerebri, or false brain tumor. The symptoms mimic a stroke, headaches, blurred or double vision, nausea, dizziness, and in severe cases, permanent vision loss or cognitive decline. When I asked Miss Moore how much vitamin A she'd been taking, her answer stunned me. Nearly 10,000 IU per day for over 5 years. No doctor had ever warned her. She thought it was just a vitamin. But now, she needs regular eye exams, pressure checks, and she's still recovering her balance months later. Her independence was shaken, her confidence too. That's the price. No one talks about the fear that comes when your brain and body betray you, all because of something you believed was safe. For older adults, the safe upper limit is around 2,500 IU daily and only when truly needed. Anything above that, especially long-term, should be carefully monitored by a doctor. So before you reach for that anti-aging or vision support pill, ask yourself, do you know what's in it? Do you really need it? And is your brain quietly paying the price? Because while vitamin A can sharpen your sight, it can also blur the very future you're trying to protect. Niacin, the cholesterol vitamin that can quietly spike your blood pressure and strain your brain. Niacin, also known as vitamin B3, is often praised as a natural way to lower cholesterol. It's sold in heart health supplements, included in cereals, and sometimes even prescribed by doctors. But what most people over 60 don't realize is that niacin, especially in high doses, can provoke sudden changes in blood pressure, stress the heart, and constrict blood vessels in the brain, creating a dangerous setup for a stroke. I'll never forget Mr. Dennis Alvarez, 82 years old, a retired postman from Florida. He came to see me complaining of intense facial flushing, pounding in his chest, and waves of dizziness that would come and go each morning. His wife thought it was anxiety. His son thought it might be a reaction to his blood pressure meds. But what we discovered shocked them all. Dennis had been taking a heart-healthy supplement he bought online. The front label said it was for cholesterol and circulation. The back label showed 1,000 mg of niacin per serving, taken twice a day. That's more than 60 times the recommended daily amount for a senior. Here's what was happening inside his body. Every time he took his niacin, it caused his blood vessels to dilate rapidly. That's why he flushed and felt warm. But shortly after, those vessels would rebound and constrict. That constriction raised his blood pressure, strained his already aging heart, and reduced the blood flow to critical areas of his brain. Over time, this on-again, off-again pressure pattern was like a hammer on fragile glass, and it was only a matter of time before something cracked. Dennis experienced a transient ischemic attack, TIA, often called a mini-stroke. His speech slurred for 2 minutes, then returned. He thought it was a fluke, but I had to tell him the hard truth. His vitamin regimen was not helping his heart, it was harming his brain. This is the side of niacin no one talks about. In high doses, it doesn't just lower cholesterol. It can trigger atrial fibrillation, increase insulin resistance, and constrict cerebral arteries, especially in people over 65, with high blood pressure or heart conditions. And the worst part? You don't even need a prescription to buy it. Many seniors unknowingly take these mega-dose supplements thinking they're doing the right thing. But the consequences can be life-altering. Strokes, heart rhythm problems, even sudden falls from dizziness. Dennis is now recovering, no longer on niacin, closely monitored, and thankfully with no permanent damage. But he told me, "Doc, I just wanted to live longer. I didn't know I was gambling with my brain." If you're taking a supplement for your heart, read the label. Look for flush-free niacin, time-released niacin, or anything over 50 milligrams, and talk to your doctor before continuing. Sometimes the heart and brain are not on the same page when it comes to vitamins. What to eat instead? Foods that fuel your brain without risking a stroke. After all, we've covered the hidden dangers of common vitamins. You might be wondering, what's left? What's safe? The truth is, your body wasn't designed to rely on pills for nourishment. It was built to thrive on real food, nutrient-rich, natural, and balanced. And for older adults, the right foods can protect your brain, stabilize your blood pressure, and lower your stroke risk far more safely than most supplements ever could. Let me tell you about Mrs. Carol Jennings, age 73, a retired school principal from Arizona. When she first came to see me, she had a drawer full of pills, a multivitamin, extra B vitamins for energy, high-dose D for bones, niacin for cholesterol, E for her heart, and a handful of others. "I'm doing everything right, Doc," she said. But her blood pressure was climbing, she was dizzy in the mornings, and her balance was off. We went through every supplement, and together we cleared the clutter. Then we built a plan not with pills, but with her plate. Breakfast became simple: 1 boiled egg, half an avocado on whole grain toast, a handful of blueberries, and a glass of room-temperature water. Sometimes she added a few walnuts. No processed foods, no vitamin-packed cereal, just real food with natural nutrients in forms her body could understand and absorb. Within weeks, the dizziness faded, her blood pressure improved, her energy returned, her mind felt clearer. What changed wasn't just what she ate, it was how she fueled her brain with what nature intended. You see, your brain is a living organ, not a machine you can tune up with a capsule. It needs hydration, consistent fuel, healthy fats, and a slow release of energy throughout the day. The best way to get that. Leafy greens like spinach and kale provide folate and antioxidants that protect brain cells. Fatty fish like salmon delivers omega-3 second that support brain health and reduce inflammation. Berries offer polyphenols that shield your brain from oxidative stress. Nuts and seeds supply vitamin E and magnesium in safe, natural amounts. Whole grains stabilize blood sugar and improve blood flow to the brain.